Hello, my name is Dr David Armstrong, and thank you for listening, and welcome to the presentation on challenging behaviour, particularly in connection with children who have, or young people who have autism. I can be contacted below at david.armstrong@flinders.edu.au. Please remember that this presentation, you can pause this presentation and you can listen to this as many times as you wish. And this presentation is a property of Flinders University, South Australia. So let's begin. The objectives of this presentation are to talk about how we can understand challenging behaviours which occur from children or young people in an education setting, how we can consider what the features are of an ideal positive behaviour support service in a setting, how we can appreciate and recognise mind blindness and other common features of autism, and be able to see the connection between these and observed behaviours, how we can understand functional behaviour assessment, FBA as it's known as, and I'm going to talk you through some of the principles and practice of FBA. And finally, I'm going to encourage you to critically frame this focus on behaviour, and suggest that focusing on a child's behaviour can be a helpful advice in some circumstances to help them change their behaviours, but that we need to understand that children are much more than behaviour, and that this is purely a device in the service of meeting the larger needs of a student with a disability such as autism. We should never see behaviour on its own. We should always understand it in a wider context. Okay, so with that in mind, let's talk through a simple question. What is behaviour? I'd like you to reflect on that for a moment. And you may wish to pause just for a moment to have that reflection. So, in that you may have experienced some difficulty or are likely to have experienced some difficulty defining what behaviour is, and if you did, you would be in good company, because behaviour is a very complex topic covered by a number of disciplines such as evolutionary biology, animal behaviour that's been discussed, as well as human behaviour for many years, and it's been understanding behaviour, what it is, what it implies about us and about animals, our close cousins in particular, our close family in particular, is out there in the animal world, is that this is a deep philosophical question. It's not a quick one that we can answer quickly, and the image there, I guess, captures that, where we have think about what the it's gorilla, this great ape, is doing with that device, with that piece of technology. What's their behaviour there? What are they gaining from that emotionally, cognitively, and what's the purpose of that for them? So understanding animal behaviour has been a major goal of zoology and also evolutionary biology. This is a deep issue across many fields. Armstrong et al. 2016 in their book talk about some of the areas of research around behaviour, moving from some of the very scientific, empirical ones of genetic and biological research through into the sociological disciplines of sociology, where we talk about family. So, and here's a range, a menu really, of some of the facets and the manifestations of concern around human behaviour within research. And remember, human behaviour connected to studies and areas thinking about animal behaviour too. So, and if we're talking about an educational context, well, a child with autism, all of these areas might apply in different facets of their behaviour in school or setting. So this is a rich and varied and deep area for research. Now, Maskey in their study carried out in England, the northeast of England, found out that students with autism and a range of disabilities similar to autism are at risk of major emotional behavioural difficulties. This is something we know from research, and Maskey's study in particular suggested that their cohort of children with autism, over half of them had 4 or more major emotional and behavioural difficulties across the areas of aggression, self-injury, tantrums, and or hyperactivity, as reported by parents and or other adults involved in their lives. So children with autism are often severely affected by behavioural difficulties, and students with disabilities of all kinds are often at increased risk of quite severe difficulties with their behaviour. So thinking about how this is registered in the educational sphere, in educational settings, we would might mention, for example, challenging behaviour, which would be Armstrong et al. Talk about this in the introduction to their book, which might be defined as causing injury to self or to others, damage to the environment. Babies might socially isolate an individual. But Armstrong et al. Also draw attention to the limitations inherent on thinking purely about children in terms of observable behaviours, and how this is quite a limited way of thinking about children. And they encourage us to adopt a bigger perspective, cognizant, mindful of behaviour, but thinking about behaviour within a wider set of factors of how the child is operating in setting and outside. And here's an example of some of that in practice. Here's Eden, a little girl who refuses to eat dinner with her brother Jonathan. And I'd like you to watch the video there, please. Pause this and just take a quick look, and to consider more deeply what we see from Eden. For example, what we see around the tantrum at dinner. I think more closely about what the triggers and effects of that tantrum are, to look really closely at the behaviour there expressed by this little girl. So, coming back to practical matters, Armstrong et al. Suggest moving away from some of the limitations around challenging or disruptive behaviour and thinking about adult concern as a way to redefine, more helpfully, more practically redefine behaviour for us, so that we can use that in terms of informing what we do about it and how we take a deeper look at it and inform interventions. So they suggest that adult concern should be the key indicator of this, and offer a definition there about how any behaviour as concern will be behaviour that is unusual, disturbing or confronting outside of a normal experience that we have as an adult, and that should be a trigger for our concern. So of course schools still use challenging behaviour or disruptive behaviour. So I'd like you in pairs. Here's a short activity which you can do if you pause, and you can think about challenging behaviour, your experiences of challenging behaviour, and work through some of these questions while doing that. Okay, so after doing that activity, I'm going to suggest that a certain view on behaviour, which is that we need to understand why challenging behaviours happen, and what purpose they serve. We need to focus on developing a broader range of skills and outcomes for an individual. That we need to think about preventative interventions that are practical and ongoing, and which are detailed in further detail, and that is given on the presentation, Developing Proactive and Preventative Interventions, which I've made public, and as well you can look at that in connection with this. And working through, really important that we begin to appreciate, or we should appreciate, the child's view of the world. We should use our own mentalising and empathy to understand what their motivations are for behaviour, and that will help us be focused in how we respond immediately to that behaviour, but also thinking about what interventions we put in place. And of course, the side effect of that is that we can also work with children to help them understand how others respond to their behaviours and develop their empathy, should that be an area they need to develop to be able to change, modify their own behaviours and replace them with more positive ones. In all of this, I'm saying also, in the rest of this presentation, I'm suggesting that you should have I'm thinking about how we maintain an unconditional positive regard for a child who has behaviours of concern that we would classify as challenging or otherwise. And I'm going to illustrate what I mean by these. And just to reiterate, just to go back a little, unconditional positive regard, of course, is from Rogers, the famous psychologist. So anyway, moving on. How is this? That's the philosophy, but how they're thinking about the practice of that, and how we would develop the practice of that. And one of the practices and frameworks we can use is a thing called positive behaviour support, which is a set of practices and a framework, but also has a philosophical aspect to it, which is about that is quite empirical and that approaches human behaviour from a behaviourist but also data informed view that we need to use data collection methods to help us test out any guesses we have about behaviours we're seeing, about what the cause of these is. So there's an empirical view of the world here that's been promoted. Now, positive behaviour support as tradition in the US and is part of what over there is called evidence-based practices, used by mandated by US legislation under the IDEA, Individual with Disabilities Education Act, on which talks about this process having to be gone through before children are excluded for challenging behaviours. And PBS is quite a comprehensive framework, as I suggested earlier. It's a philosophical view, also a very practical and quite detailed framework that can be adopted across a whole setting by a whole set of professionals in responding to challenging or other unwanted behaviours by children or young people. And there's detail there if you wish to look further about this. Now, okay, so there's the philosophy, there's the background, policy background, but I think coming back to what we really want to find out, well, you might ask, okay, Dave, that's great, okay, PBS, interesting, but what would you actually see? What would it look like? It's an abstract idea there. And here it's a great interview with Peter Baker, who's a clinical psychologist in a specialist behavioural support unit in the UK, and Peter Baker talks in detail about what you would and wouldn't see in a positive behaviour, a setting that uses positive behaviour support. And I urge you to look at that interview, and it's a great interview with Peter Baker, who's a very charismatic practitioner, I would suggest. So, and that there's some points there for discussion. I'll in anticipation that you have viewed that resource, and remember you can pause at any point. I'm going to go on to outline some of the things I see out of that interview with Peter Baker, and where he talks about how good PBS services have practices that fit with the needs of individuals, that are flexible enough to do that, rather than, and in many cases, bureaucratic or other administrative practices which seem designed to generate conflict with children who have behavioural difficulties and whose behaviour is of concern to us. So thinking about how we have also have strong relationships with children, and that's the core of our work with them, and that we need to step back toward rather than back for individuals when we see them leading up to behaviours that are destructive, that we need to engage with them. Of course, thinking of our safety there, but that we need to talk to them and try and engage with them as a way of de-escalating those behaviours. How we need to have staff who understand the individual as a person in a good PBS service, how we would have this positive unconditional regard for individuals in a good PBS service, and how we don't necessarily need a highly clinical focus in a good PBS service, but which under the surface there has been a lot of data collected about issues around a child's needs and what are the triggers and the antecedents, behaviour and consequences of their behaviours. So we have under the surface all this evidence gathering, but that's not the focus of our interaction with them. And of course, in all of this, the emphasis they're given is that there's a strong importance here, and this is my interpretation of it, I should say. Empathy is very important in this process, and we need to have a process of mentalising, understanding the mental states of children and young people in our care and our students, which has been supported by research from Adi and Alison. So here's an activity which you can undertake, and remember that you can pause this at any point to do this activity, which I encourage you to do. Moving on, in anticipation that you have paused that activity at that point, I'm going to talk about some of the challenges that we already know children with autism have around mentalising, and which I've just mentioned that we should have as practitioners. And we know that many children with autism and other behavioural difficulties such as conduct disorder often struggle here and have a difficulty and with this area, and Baron Cohen in his research talks about this, describes this in terms of mind blindness, which is perceived insensitivity to others' feelings, inability to understand others' meaning, intended meaning, and to understand what they might think of our actions. And the question here for us, which I want to pose to you, is how do you think these difficulties, these challenges for a child, feed through into how they interact and what we might see in the classroom in their interactions with others, with their peers and with us? We need to reflect on that really, in terms of when we're framing what the behaviour they have. We can also, falling on using rather the functional behaviour assessment and under PBS, positive behaviour service, think about how we should understand behaviours more deeply. So thinking about what does the behaviour look like, what's the function of the behaviour from an individual's perspective. Here's a small reflection at the bottom here to help us do that, where we can think about a challenging behaviour we've witnessed from a child or young person. They can be have autism or some other disability, or no disability even, but think more clearly, what did it look like? What did the behaviour really clearly look like? What did we see in this challenging behaviour, and what did we think the purpose of that was? So here's a reflection you can have on your experience of a challenging behaviour in terms of its appearance and its purpose. In anticipation that you have done that, and remember you can pause. Here is some of the a little bit of a framework here for what we might see in terms of aggression. Behaviours connected with aggression, behaviours connected with tantrum and with non-compliance. And I just want you to have just a little bit more of a reflection here about whether behaviours we've seen have fit any of these subcategories, or all of them indeed. And the last subheading here is where a child withdraws completely from the outside world, or doesn't respond back, part of a process of withdrawal sometimes. So, and how this can be what psychologists would describe as internalizing behaviours, quite negative. Now, in thinking about this last row here, where a child primarily plays alone and doesn't respond to peers' attempts to play, I want you to think about how damaging you think this might be to a child. Although it's not classified typically as a form of externalizing or challenging behaviour, But just to consider this really, and to be mindful that this is extremely damaging behaviour, but one which is we might not notice as much as some of the other aggressive or non-compliant behaviours. And just have a reflection on that. Think about, are we connecting how damaging a behaviour is with how we label it and whether we recognise it or not. And I'm suggesting to you here that that's related to how it affects us directly, not necessarily how damaging it is to the child quite often. So, moving on here from that reflective part there again on behaviour. One of the things to talk about is that we can have a functional assessment of behaviour, a functional behaviour assessment. It's sometimes moved around. Same thing, FBA, and which is a structured way to help us think more deeply about this process, so that we move away from simplistic understandings of it, and that we move towards a problem-solving mode. Its problem-solving mode is FBA, which encourages evidence-based practice. FBA begins with the assumption that if a learner repeats a problem behaviour, it happens more than once, that behaviour has a purpose, it has a reason, there is a motivation for it. Sometimes the learner's not always aware of that motivation, of course, or maybe fully express that, but there's some purpose there for that. And FBA looks for patterns in behaviours that we perceive, that we observe. Calling on, here's an image source from http sciencenotes there, .org, calling on a scientific method here, broadly scientific method, that we make an observation, we form a hypothesis, which is a best guess, we perform an experiment. In this case, we would look more deeply at a child's a background and talk to others. That would be interpretation in an education setting of performing an experiment. We would analyse all that data that we've gathered. We would report our findings in this process will be in terms of producing a behaviour support plan, and inviting others to reproduce the results. Well, fits kind of loosely here, but in the FBA mode, functional behaviour assessment mode, that would be roughly where we might ask others in setting whether they have seen the same results, the same behaviours as we have seen, and in what context. So we might ask others to also observe for us. So broadly, here are some of the functions of behaviour that we need to think about. Again, moving back to what's the purpose of these behaviours, and here are three common functions or purposes of behaviour for children with autism, certainly, and for many children with many forms of disability, which is to obtain something. That can be obtain attention, or obtain an activity, a toy, food, materials, sleep, any of those needs, or to escape something. So to escape attention of an adult or peer, or to escape an unwanted activity, a toy that's not desired, a food that's not liked, a material or an experience that's hated. So, and also, interestingly, one that is arguably could be added is to seek self-stimulation, particularly thinking about under or over sensitivity to the senses, and which often affects children with autism, where hyper or hypo stimulation can occur, and which a behaviour can meet that need, that physical need. So here are some examples which I will simply talk you through, and I want you to consider. Remember, you can pause at this point to help you read and consider these. We have Sean, and what do we think the function of Sean's behaviour might be? And also you might want to just consider how Sean's teacher reacts to Sean's behaviour, and whether this reinforces or doesn't reinforce Sean's behaviour. So those are points of discussion. I want you to think about Angela, what Angela's function of Angela's behaviour is, what's the purpose of this behaviour. And I want you to think about John. So what's the function of John's behaviour? What is John trying to gain through this activity? And I'm not going to tell you what the answers are there. I think you can possibly guess, but I'd like you just to think about those and consider those. Thinking about the FBA methodology, where think about what's the triggers, what's the cause, what's the consequences of the behaviour, and what the motivations here for these behaviours. So here's looking more deeply into this, where we can identify the functions of behaviour, thinking about how we work in a more detailed way. So we can look carefully at the situation in which the behaviour occurs. We should identify and describe the challenging behaviour, and by describe I mean in as real detail. So for example, rather than just put challenging behaviour or negative behaviour or child was angry, think in real detail about, as much detail as we can, about what exactly that child is or young person is doing at that point, in detail of their physical expression of the behaviour, their facial expression, their actions, even the reactions of others to their behaviour can be here, where we identify what events, people, activities are associated with their behaviour. That could be times of the day, and remember, as I said earlier, thinking about it could be to escape unwanted behaviour here, unwanted attention here. So to help us do that, we can think about antecedents, what happens just before the behaviour occurs, people, events, things, what the behaviour consists of, which is what I've just discussed, and moving on, the C of consequence, what happens as a consequence of the behaviour, what's the payoff for the child, what did they receive. And here again, talking through this process in more detail, here are some questions we can go through in this consideration of it, using our ABC, the broad category there, using functional behaviour assessment, the bigger process there. Some questions. I'll let you read those. I'll just draw your attention to the last couple here, 9 and 10. If the child is ill, or there another physical issue, this may be very pertinent. This may be a real motivator for negative behaviours. And also, if the child's family are in transition, or there is a change in a child's life, again, this can be a real trigger for behaviours and a real hint or hook into possible points of intervention or support for a child there, thinking about how we can really use this process to really focus on what we need to provide for children or young people to help them overcome and overcome some of these behaviours through replacing them with more positive ones. So here are some further questions which I always talk to practitioners about. The behaviour we're seeing when we're observing a child, would the behaviour occur if this child or young person was left alone? Does it occur following a request to perform a difficult task? And if so, what should we do there? Should we think about an alternative, or think about, does the child need more scaffolding for that, or does the child need some support there? And does the behaviour occur when the teacher talks to another person? So is this is there an intentional motivation? Finally, thinking again, reiterating about the physical needs there. Is it food or comfort that are stimulating this behaviour? Moving on here, kind of extending this, the ABC analysis as part of the FBA, it provides us with an informed hunch which is described in the literature in terms of that hypothesis statement that we can produce, which is a statement, a detailed statement about what we think is the cause of this behaviour, our hypothesis being the hunch we have about the cause of this behaviour, calling on all of our assessments. And to do that, we can frame our assessments and present them and analyse them to see more patterns in terms of scatter plot graphs and other visual tools we can use. I'm not going to talk in detail about scatter plot graphs and other visual tools we can use, because that will be another presentation, but just to draw your attention there that we can use these as tools to see and present the patterns that we think we've found in data, to discern those patterns. Here's a really quick one I'm going to talk about, another quick one which I think is suitable for this presentation, which is to use a snapshot method, which is a direct observational tool we can use to obtain a snapshot picture of events that are occurring prior to and following a challenging or unwanted behaviour. And I want to stress that the ability to observation is an underrated skill quite often in my experience, that observing to a high quality observations, to be able to achieve those is a highly skilled task, really. These are highly skilled tasks. There's a high level of skill associated with high quality observations, and it may be in my experience that many teachers have not had a great deal of training, if any training, about how to carry out an observation. That might be something you want to follow up in your own professional learning, looking at how you can develop your own skills in observing children and young people, and with the purpose of using an FBA. But here's some of the structures we can use in our observation to help us use an FBA, help us gather that data in a structured way. We can think about recording the context as part of the antecedents, and the social context against antecedents, so and the child's response to those potential triggers in the environment, and looking at the reaction that next from others to their response, which may be a factor in their behaviours if they're wanting to receive or to avoid attention. And then we can start to hypothesise, make a guess about the function of the behaviours. So let's practice some of these. There's the abstract of snapshot method. Let's practice with a fictional girl called Helen, who's a 6-year-old who has autism, and the teacher, Helen's teacher, notices that during playtime Helen is socially withdrawn and spends a lot of her time spinning the wheels in a toy car or rocking back and forth. Helen's teacher is concerned. So remember I said right back at the beginning, thinking about adult concern as a key trigger for a process of evaluation, this FBA process, and then later intervention. So a process for action, essentially by a professional. So Helen's teacher is concerned here. So let's look at Helen's snapshot of what Helen's teacher did. So Helen's teacher, if she were to fill in this using the snapshot method, would think about how that the activity context was outside, how peers were playing on the playground, and Helen's response back to her peers was that Helen plays by herself. Helen gets Helen's peers in response ignore her, have essentially excluded her. Whether that was intentional or not is another matter. So the possible function here of Helen's behaviour could be sensory and connected, and I use sensory here in a broad term, as in connected with understanding of her senses of the world around her, sensory processing. But Helen, of course, has weaknesses in her social skills, in her ability to respond, and we would be able to know, just going back, that Helen may have those because she's socially withdrawn. So moving through this example, so if the teacher were to do further observation and did observation, the teacher might notice that Helen was unable to respond. It wasn't an active choice by Helen, she was just simply didn't know how to respond to her peers. even when they'd asked her to play, and we would only pick that up through doing this, that that this is a result of several observations that we saw, that Helen's peers actually invited her, but Helen simply didn't know how to respond. So here's a case working through how a snapshot could be done in the case of Helen. So let's just pose a question, and I'll pose this to you. I'm not going to give you an answer. What would be a good replacement behaviour for Helen here? How would we replace Helen's behaviour? And I'll leave you with that, really, to think about how we could replace Helen's behaviour, of how non-response could be replaced by response. What would we need to teach Helen to replace that? What would we do to replace that? And I'm just moving back to help you focus on that. So that leads into another presentation which I've given on proactive and preventative interventions, where I talk in more detail about that. But I just want to leave you with that consideration. What would we need to do? Would it be social skills training, perhaps? Working on helping Helen to develop a social skills or an interaction. So, moving on. Here is a discussion. There are other ways to record unwanted behaviours, and here's one from that's available publicly, which you may wish to look at, but this is a more complex one. As I said, I'm not going to talk in detail about how we record unwanted behaviours and what graphical means we use to do those. That will be another presentation. I shall, however, move into the end of this one, which is to summarise what I've covered. Now, functional behaviour assessment, FBA, is a vital and valuable ingredient in what we do, and I've talked you through that process. But I think we need some perspective on it also at the end, and I think this is a good place to talk about this. It is the meal. I always use the meal analogy here. FBA is a really useful tool that we can use. It is the protein, it is the rich meat of a meal we could have, but it is not the whole meal, and it is a means to an end, as indeed is our focus on behaviour. So when we think about concerning behaviours by a child, it's really important that we connect this in with a bigger agenda, which is helping the child to communicate, to develop intellectually and personally. And I think Helen's case and other cases I've talked you through in this presentation bring that home, really. That these are FBA and the focus on behaviour is in the service of this wider goal, the whole meal, which is to provide a whole meal, a whole level of support for a child. And that's part of our PBS service, really, that our PBS service, moving back to what I discussed earlier about what good PBS service looks like. This is a whole, which is described in some contexts as a wraparound service, but a holistic service for meeting a child's needs. Often behaviour is a key part of that, but it's not the whole part, and we need to bear that in mind when we're thinking about behaviour. So I want to leave you with that thought. And another final one to leave you with is that everything I've spoken through in this presentation is to help you think about how you can use this process of PBS and of FBA to translate into more effective practices and interventions and support for children, but affected by behavioural issues. But think about that. The other big factor on that is that these sorts of services rely on careful implementation. How we implement these in practice, the theory of this is vital, and it is a really important thing to consider. So implementation is a vital factor here. So the next steps for you when you go and implement some of these ideas I've been talking about is to bear that in mind and think about implementing strategies that are realistic, that are achievable, and that are based on good data we've gathered from the child and or young person. So I'll leave you with that, and I shall say here are some readings and references I've referred to, and I shall recommend, for much more information and advice, if you please read my book, Understanding Child and Adolescent Behaviour. That provides a lot more information and advice. And I shall say thank you for listening and wish you happiness and sunshine wherever you are. Thank you.